Hi, this is Dr. Peter Grinspoon. Today we're talking about the herb Kratom. Thank you so much for listening to my YouTube channel. Before we get started, please remember to subscribe by pressing a button for free on the lower right of your screen, and then you can be a subscriber to my YouTube channel. What is Kratom? Kratom is an herb that many people encounter in gas stations, in smoke shops, in natural health and wellness stores, and even on the internet. People buy it under the heading of like aromatherapy, because you're not really supposed to sell Kratom, which is a psychoactive drug, on the internet. So people buy it under a fake name, but it's sort of like wink, wink, nod, nod. This is Kratom. Kratom is used for pain control, for withdrawal from opiate addiction. It's been used in Asia for hundreds of years for like diarrhea, cough, again for pain. It's used to increase libido. It's used to increase sexual energy. People in this country have very, very different opinions about Kratom. There are millions of people currently using Kratom in the United States, again, for pain and mostly for opiate withdrawal. Only about 20% of people in this country get adequate treatment for opiate withdrawal, and a lot of people are self-treating with Kratom because it works on the opiate receptors, and it helps people transition off of opiates or not miserably withdraw when they can't find Suboxone or the other medications that we treat opiate addiction with. So there's a huge vocal following for Kratom in this country. At the same time, the US government, the DEA, and many doctors think, why do we need another addictive opiate-like medication during the opiate crisis? They're worried about the dangers of Kratom, and there's even been some movement on the part of the DEA to criminalize Kratom, which, as we'll talk about below, would be an absolute disaster. So people take Kratom in the form of pills. They can mix it in a tea, which is very common. It tastes absolutely disgusting. I've tried it. They can also get these very, very powerful Kratom extracts, which I think are a little bit dangerous. Now, what are the problems of Kratom? The problems with Kratom are twofold. One is that, like any drug or medicine, it can cause side effects. It can cause diarrhea, hypertension, nausea, vomiting, and particularly constipation, because it's an opiate. And in rare instances, it's been stated to cause respiratory arrest, you stop breathing, and seizures. The federal government, the FDA, has even attributed, like 50 or 60 deaths to Kratom. But you have to take this, like everything during the war on drugs, you have to take what the US government says, unfortunately, with a grain of salt, because in the deaths which involve Kratom, there are also other drugs involved. So you don't really know if the Kratom was responsible for the death. And, if you take too many opiates, it stops your breathing. It affects the respiratory center of your brain, and you just stop breathing. Kratom isn't that strong an opiate, and it works on a lot of different receptors. So it's really unclear whether Kratom has caused any deaths. You can get addicted to it. You can get addicted to any drug that causes euphoria and relaxation, and that's called Kratom use disorder, just like we have opiate use disorder or alcohol use disorder. There are a few cases when people have had to use Suboxone, that very strong opiate treatment that we use to get people off heroin and fentanyl, to treat Kratom use disorder. So it's not without its side effects. The other problem with Kratom is that it's not regulated at all. The FDA isn't regulating it. So if you were to buy Kratom on the internet or in a gas station or in a smoke shop, you don't have any idea what you're actually getting. It could be filled with industrial byproducts. It could not even have Kratom at all in it. So again, this is a natural herb that helps people with opiate withdrawal, that people use for opiate related symptoms, and people use for chronic pain, which is very undertreated in our country, unfortunately, because doctors don't do enough to treat chronic pain. And also our health system is sort of in tatters these days, as anyone who's tried to find a primary care doctor who has been to the emergency room recently knows. So people are self-treating with Kratom. People think it's really, really helpful. The government is really against it. So what is a path forward? Number one, we need much better regulation of Kratom. Somebody's got to regulate it. Right now, there's no adult in the room regulating Kratom. So if we regulated it when you bought Kratom, you would know what you're getting, how much you're getting, it would be accurately labeled, and you know that you wouldn't get all kinds of this industrial byproducts and crap. It costs less to make an awful product than it does to make a very high quality product, and if nobody's regulating the products are going to be very poor quality. Secondly, we need much more study into both the harms of Kratom and to the potential benefits of Kratom. Then we can know what are the real harms of it, what are the dangers, and how can we use it safely and effectively. What are the right doses and what are the right methods? Are the pills better, the teas better, the extracts better? And third of all, we just need a lot of education, because people are trying it, they're buying it, millions of people are using it, and people don't really know about it, which is part of why I'm doing this video. So again, we're talking about Kratom today. Thank you for listening to my YouTube channel. This is Dr. Peter Grinspoon signing off.